So they're privatizing, they're privatizing public healthcare in this day and age in Kenya, when we're looking to have universal health coverage by 2030. That's our vision, that we're gonna have a healthcare system that is free. The Honorable Kimunya just signed off some amendment to the health amendment bill. And it's horrible. They basically don't want doctors to run hospitals. They want businessmen, people with MBAs to run hospitals. This is what they want. They don't want doctors to regulate themselves. They want businessmen to regulate themselves, to regulate doctors, businessmen. This is because they find it difficult for doctors to privatize healthcare. Kenyan doctors are with the patients. We see how they suffer. We see how patients come in barefoot, with no money, and with very sick, and they need these expensive treatments that they can't afford. And they're bringing up WhatsApp groups and M-Pesa, Changa, M-Pesa, and all of this. This is happening everywhere. It's not happening just to poor people, the traditionally poor people, but even middle class, even upper middle class people. I mean, once you have a bill of 2 million, that's it. You can't survive in a private hospital. And so doctors are seeing this, and we're saying we have to find a way that the government can pay for healthcare. We want a tax-funded healthcare system. Everyone pays tax, so why doesn't the government use that tax to fund their healthcare? Healthcare is not something that should make someone bankrupt. Healthcare is something that should be shared in the community. It shouldn't make somebody bankrupt. Just because you're sick and you've worked your entire life, you've worked for the country. And these people, they want to put in the hospitals. They are not going to get in public hospitals. They're not going to get their healthcare from the public healthcare. No, they're going to go to a private hospital. They're going to have insurance, deals, and they'll be flying to South Africa for their heart treatments and whatever type of God forbidden illness they'll get. So they're going to use the private hospitals, but they'll later wananchi use public hospitals that are privatized. I mean, there's no doctor that is in support of the current health amendment bill. No doctor. And I'm calling to all doctors, all healthcare workers and citizens to reject privatization of healthcare. Hospital bills should go down. They shouldn't be going higher. We should have doctors managing these hospitals, because doctors want what's best for their patients. We see the pain. That's why we keep the bills in public hospitals low. This is what we've been doing. But the government now, it seems, are being arm twisted by the private sector and by, I think, international stakeholders like IMF and World Bank, to start making Kenyans pay for this, for healthcare, exorbitant prices. No, we don't want that type of healthcare. We don't want out-of-pocket expenditure from patients. We want a tax-funded universal healthcare system where everybody gets healthcare without going into bankruptcy. And so, ladies and gentlemen, that's my rant today. I am very angry. I am very, very angry.